Okay, guys, so we're here again talking about discography, radiography, or this discography, you can also call it what? Discogram. Okay, so it's another form of what? Imaging, imaging modality. And this form of imaging modality is just like the name implies. It's mostly used to what? Check out for your spinal disc. Okay, so you're trying to find out which of the spinal disc actually has a problem. Okay, trying to find out which of the spinal disc actually has a problem. Okay, so we'll talk about this imaging modality. We'll talk about the characteristics, the uses, the procedure, the risks and side effects of this type of what imaging modality. Okay, so for this discography, we see that it is also known as what? A discogram. All right, so it's actually an interventional what? Diagnostics imaging test. So interventional meaning it will help you to be able to what? Diagnose some certain spinal problems accurately. Okay, so some certain spinal problems accurately in the sense that spinal problems like back pain mostly, okay, or maybe a prolapsed spinal disc and all of that. This will help you to what? Be able to diagnose these problems accurately. So, what is the characteristics of this type of imaging modality? For this type of imaging modality, we use contrast injection. So, it actually involves what? Injecting a contrast dye into the center of one or more spinal disc. Okay. The imaging guidance, it uses things like x-rays or CT scans just to guide the injection, then visualize the disc. Okay. Then pain reproduction. The injection may actually what? Reproduce, okay, the back pain symptoms. So this will help you to identify the problematic disc. Okay. Uses. This type of imaging modality, that's discography. It is used to what? Diagnose the cause of what? Chronic back pain, especially when other imaging modalities like MRI or CT scans are inconclusive or they haven't actually yielded results. Okay. Then pre-surgical planning, it also assists in what? Planning surgeries such as what? Spinal fusion. Okay. Mostly by what? Identifying the disc, okay, that need to be treated or removed. Okay. So for the procedure of this, how we can be able to do this is first of all, you prepare the patient. So the patient needs to stop taking some certain medications or avoid eating or drinking for a few hours before the procedure. Okay. Then injection, um, a needle is inserted into the disc, and the contrast disc is what? Contrast dye is injected. Can I say right into this place? Okay. So that I can be able to what? Have a clear image like this. Okay. So imaging now, so you can use x-rays or CT scans which can be taken, okay, to capture detailed images of the disc. Okay. Observation, the doctor observed the patient's response to the injection to determine if the disc is the source of the pain. Okay. The risks and side effects, you have a risk of infection, so there's a slight risk of infection at the injection site. For pain, the procedure may temporarily increase back pain. For allergic reactions, some patients may have an allergic reaction to the contrast dye. Okay. The benefits, this helps us to what? Do an accurate diagnosis. Okay. So it provides valuable information to help diagnose the cause of back pain. Okay. The targeted treatments, it actually helps doctors to plan more effective and targeted treatments for spinal conditions. Okay. So I think that's it for what? Discography or discogram radiography. Characteristics, uses, procedure, risks, and side effects.